All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. We're now doing our last part of our procedure for our acne scarring patient, a big combination, deep microneedling radiofrequency. We just did spot areas of CO2, and now I'm doing halo on top. Halo is our fusion laser. This goes deep and superficial. In the old days, we used to combine all of our lasers with a light erbium resurfacing. That's basically what halo does. It takes a non-ablative laser and it uses a ablative laser, an erbium laser right on top. Turn to the right. That's going to allow her to heal faster. It's also why I did the spot area of CO2 already. Turn a little bit more right. There you go. Perfect. Already, because it's going to enhance the CO2 that I just did on her cheek. She prepped with a peel, so her risk of hyperpigmentation is lower. She did a CO2 before with microneedling radiofrequency and got a really good result. Jordan, you want to show them that outcome?
Yes, let's show them the outcome that we got. Here we go. This is our outcome from last time. Look at all that giggling. Look at those deep indentations. Look at now. That's after one treatment, guys.
And that's also with the Bellafill to plump the scars.
Precision as well with her.
Precision and a stronger laser, CO2, and microneedling radiofrequency. So now we're doing our second treatment. And if she gets a really good improvement from these, she can extend the next treatment out a little longer. Otherwise, we do another 6 to 8 weeks, and then we go every 8 to 12 as maintenance. She'll start derma rolling in a week when she peels. And right now we're focused on just building this area and improving the area. So now we're going to wipe off the left cheek.
Alright, we have our Cyton people on here.
We're going to wipe that off. Good. She's going to wipe off the left cheek so I can map. We just did halo, one area. Take a look. That is we see our little dots on there. That's the erbium. And now all those little dots are going to peel and improve the texture of her skin. We're now going to do that on her cheek area. Remember, not too hard over the CO2. Chin, wipe the whole chin. So we're cleaning off right now. Okay, go get it real dry. I'm going to start to map.
What is this machine that I asked you guys? This is our Cyton Halo laser.
Now I'm going to map your
This
cheek.
is on our Jewel X platform. The single guy is back on here.
So we're cleaning her off, get her real dry.
Would you recommend derma rolling after 2 weeks at home?
Yeah, what did I just say?
Guys, we love our derma roller. We love using it.
We have a whole protocol. We also have an entire blog at emeragecosmetics.com on how to do it. We also tell people right when you peel, you start it. You got to use it with Hyla B. You got to use it with my Aerify. Here we go, our Aerify ampule. And you would apply our retinol mask right afterwards. So
I want to know, what is the highlight of your week, Dr. Allen?
Oh my God, I don't even know. I'm doing everything, you guys. I'm doing lasers. I'm doing lipo. I'm doing fillers. Obviously, I love that. Meeting new people. Going to the gym. Just a lot going on lately, guys. A lot going on. So now we're doing that on the cheek area. You guys can see all the little dots forming. How are you doing? Are you okay? Beautiful. She's doing great with the nerve blocks and the topical. Turn a little more to the right. I'm going to show you guys what we do. What?
Very specifics about your numbing.
Yep, can't tell you that.
They want very specific numbers and mixtures. Nope.
No.
We're not telling you.
Can't tell you that stuff. We're going to focus on my combination. You guys can see through here we did our CO2 in that area. Now we're going over it with the halo. And she's doing really well. We're gonna do a large density because I really want that long-term collagen stimulation. Turn to right a little bit more, just a little bit. There you go, perfect. The deep 1470 is going to build collagen over time, keep that skin remodeling. The erbium and the CO2 are going to make her peel and get rid of a lot of the surface
I
irregularities.
want to know, is a halo laser only operated by MD?
No, you can have nurses or PAs do halo as well. The different pricing. Tell them about how to make an appointment.
Guys, get a consult. Our PA, Nisha, loves doing halo. She can help you out. We have different pricing for her as well. Send us a DM, full name, email, phone number. She is specially trained by Dr. Emer.
Exactly.
So she can use all his secret settings too.
That is right. So our goal is really good tissue remodeling. And remember I said in the old days, we did lots of erbium with CO2, which is basically what we're doing here. Halo is erbium combined with a non-ablative. So show them again what she looked like before. I think you should show just the before of this cheek.
Yes, let me show you guys the before of this cheek, right? Here's the before. You see the indentations all hitting. Here's right before we did treatment today. Let me show you guys.
Give them a second though to look at that. So that you can see the before there, which has a lot of indentations. We had to do filler, microneedling, radiofrequency, and laser, and subcision.
So that's where we're at now, guys.
But now we've progressed. And now we're on series second treatment. Almost done, one more pass.
I wonder what kind of scars are those?
You know, they're a mix of boxcar and rolling scars. Not really ice pick. These are more broad and indented. You call them atrophic, boxcar, whatever you want to call them. They're just scars. Okay, I'm going to turn you now to the left. We're going to wipe you off there. So you guys take a look. You're really good with the halo. Now we're going to clean off this side and the nose. So we're going to get all this done. You can see the CO2 there, all a little scabbing. Remember, CO2 delivers a lot more heat.
How much for treatment like this? Guys, send us a DM, full name, email, and phone number. We'd love our coordinators to reach out to you. Alright guys, so is this microneedling? No, it's not, guys. We're doing our halo laser treatment. This is our hybrid fractional laser from Cyton. We just did a CO2 before, and we did that microneedling that you're talking about. We used our Pixelate by Roar 6 deep microneedling with radio frequency. It allows to deliver energy deep into the skin to help retexture those scars and build collagen long term.
This is doing really well. We're gonna go, love it. We're gonna go now on the other side. And you guys can see where we did the CO2. This erbium will help the CO2 heal and give us a more enhanced result. And she's smiling, which is great because obviously this is a little bit of a torture procedure, slightly, but the outcome's worth it. So that's why we're doing it.
How many treatments are required?
No requirement. The more you want, the more we
you get,
want to do, the better we get. It's just like exercise. The more you do, the better you look. So we're going to hope that we can get a lot of improvement in the first two. I'd probably like to do one more even after this, closer together, and then we go quarterly or as often as she wants to keep getting improvement. We don't need to go as strong as well once there's a lot of improvement. She's doing great. You guys see we have a really amazing goggles.
Watch, let's read this one out and see what Dr. Emer says.
Tell me.
So painful. Please put Aquaphor and Vaseline to heal. Don't listen to their other products.
No.
Aftercare Vaseline is the only thing to stay moist and heal.
That's absolutely not true, you
That's
guys.
very wrong.
Aquaphor and Vaseline actually holds in heat. It often causes acne breakouts and prolonged redness. It often clogs the pores and causes a really bad reaction. And Aquaphor has lanolin in it, which often will cause allergic reactions. I do not. For years and years, we used to do Aquaphor and Vaseline and Crisco. We have to use strictly lard fat to help things heal. And then technologies started coming in. Stem cell therapies, growth factors, hyaluronic acid, exfoliation enzymes, and proteins. Those are what's going to help your skin heal much more quickly. The stronger the treatment, the more the downtime. The average CO2 is about a week, but if you go really strong, it could be 2 to 6 weeks for healing. And so some of the ones that you guys have seen recently, like our Roar device, that's about a 3 to 6 weeks in healing. So you can't expect what a halo downtime is if you're doing a really strong, almost fully ablated multiple pass CO2. That's our old school, what we used to do, about 6 weeks of healing. 2 weeks of like scabs to find and come off, 2 more weeks of pinkness, and then another 2 weeks of sensitivity and light pink. All coverable with makeup once it heals. So turn a little.
Does this address fine lines around the mouth?
Oh yeah, but you need the CO2 around the mouth for that. So what we just did on her cheek, we would also do around the mouth. But it will improve it a little bit, you see, as we're going over the mouth. With the laser, and we're getting, you see all that area that's going to exfoliate. Everyone responds to this differently. So yeah, I mean, what else, Jordan?
That's it. I think we're good.
All right, you guys. So we're gonna finish up Halo, and then we can do a little testimonial with her after, and we'll keep following her outcome over the next few weeks, and then until the next one, you guys. Have a good day. That's fast.